Welcome to another edition of This is Public Health, a podcast from the Illinois Department of Public Health. Our focus today is on environmental health. It's a term that applies not only to health concerns related to air and water, but also to potential health concerns within our homes. Our guests for this edition are Aaron Martin, the Section Chief for Environmental Toxicology at IDPH, and Kurt McAfee, the manager of the Illinois Lead Program. We thank you both so much for joining us. Well, let's begin with health and environmental concerns inside the home. June is Healthy Homes Month. So, Aaron Martin, let's talk in some general terms about healthy homes and what are some of the common concerns that can pose health risks within a home.
Thanks, Jim. Thanks for having us. I thought it might be useful to start off with a common understanding of what constitutes a healthy home, or what are the characteristics of a healthy home. If you go to the U.S. Department of Housing and Urban Development's website, they have 8 principles of a healthy home. Those are clean and dry. A healthy home is safe. It is well ventilated and well maintained. It is both pest-free and contaminant-free. And the most recent principle they've added is that a healthy home is thermally controlled. Now, some common concerns that we hear about from the general public include things like mold and water damage. Over the last 20 years, that's probably the most frequent concern that people have contacted us about. But it also includes things like carbon monoxide, radon, lead, and mercury exposure.
We're going to cover many of these areas in the course of this discussion, but I want to start with lead. And for that, we'll turn now to Kurt McAfee, again, manager of the Illinois Lead Program. Lead in homes is still a big problem in some parts of Illinois, despite efforts and a lot of progress in recent years to address the issue. Kurt, why is lead such a concern? What effects can it have on people who are exposed to excessive amounts of it?
Thanks, Jim. Well, lead is, of course, a naturally occurring element been used for thousands of years to shape our civilization. And in fact, the Roman Empire used lead for a variety of reasons, like to line their vast aqueduct systems that carried water throughout their territories to an actual food and wine additive. Lead acetate is a sweet additive that they used in their wine and other actual foods that they made. They called lead plumbum, which is where we get the term plumbing. Other beneficial uses to lead throughout history, but the primary one we most frequently concern ourselves with today is deteriorated lead-based paint. Lead paint was banned for residential use at the federal level in 1978, but there are millions of homes nationwide that still have lead in them somewhere. In fact, in Illinois, it's estimated there are about 1.4 million home housing units that still have lead in them somewhere.
That's a remarkable number, and that's with lead paint, as you noted as well. The word of lead in ancient Rome translates to plumbing, so we know there's still some issue of lead pipes in parts of the state as well. So how does somebody know if they do have a problem with lead in their home, paint or pipes or whatever it might be?
You can get lead from pretty much anything because we used it so much. It was so pervasive in household usage. But the only way you're going to know whether or not you've had it is to have somebody come out and test. We don't like to use kids as canaries in the mine, so to speak. But also, we in the lead program specifically suggest that any small child, 6 years of age or younger, go and have their healthcare provider test them for lead in their blood. But if there aren't kids in the house or you don't want to do that straight away, you can also hire an IDPH licensed individual who carries the license of a lead risk assessor or lead inspector. And they can come out to the house and then test it and determine whether or not there are lead hazards at the home. And then further, if there are, that person, specifically the lead risk assessor, can offer up treatment options.
How easy is it to address a concern like that if there is lead paint in a home, if someone is getting water that's running through lead-lined pipes? How easy is it to fix those concerns?
I don't want to say it's straightforward necessarily. However, we've established through years of rulemaking processes a specific way. It's come from the top down. The U.S. EPA has authorized the state of Illinois to be an authorized state to have our own lead program and to derive our own rules and regulations. But the Illinois Lead Poisoning Prevention Act actually predates the federal Lead Poisoning Prevention Act. So we've been aware of and sort of a forerunner for many states and many statutory incidents with regards to childhood lead poisoning prevention.
Let's talk more in detail about children exposed to lead. We know this is a particular concern for children. How can you tell if a child is suffering from lead exposure? How does that play out? And then how would a child with those effects be treated?
As I noted earlier, you won't be able to tell usually from outward symptoms that are associated with lead exposure. There are those, but they sort of mimic so many other things that you'd see in a small child. Hyperactivity, all the way from hyperactivity to lethargy to diarrhea to vomiting. That could entail a number of things. So it's not until you actually take the child and have a blood lead test to determine specifically whether or not they've been exposed. It's just best to have a blood lead test done at the child's healthcare provider. And that's really the only way to know if exposure has occurred. And if the test does verify that the child has been exposed, it will open up a case with the Illinois Department of Public Health's lead program. We receive all the results here. And our surveillance system, where we place those results, will issue an alert to either ourselves or a local health department that we have a grant agreement with. And the individuals is responsible for responding will contact the family, perform a case management home visit just to educate and assist the family through the process. And then on the other side of that, IDPH or the local health department will send a risk assessor to the home to test and identify any and all lead hazards. And from there, we work with the homeowner to ensure that those components are remediated to eliminate further exposure to any of the inhabitants, current or future.
And can those effects in the child be reversed with medical intervention?
That's a great question. No, they cannot be reversed. They can simply be treated. Once you've been exposed to lead, any damage that has been done is essentially long-term. Say a child gets exposed to a heavy dosage, an acute dosage or chronic, doesn't matter, that is large and impacts their ability to think, learn. That stuff is carried forth with them throughout their lifetime.
Which is, again, why it's so important to have that early intervention and to make sure that families are checking for this. You can learn more at the Illinois Department of Public Health website, dph.illinois.gov. Search for lead. Many more details there about this. Kurt McAfee is the manager of the Illinois Lead Program. And Kurt, thanks again for being here with us on This is Public Health with the Illinois Department of Public Health. We want to turn back now to Aaron Martin, Section Chief for Environmental Toxicology at IDPH, talk about some of these other issues in healthy homes. And Aaron, you mentioned earlier, mold is a major problem. What issues can mold cause, and what steps can people take to prevent those problems?
Jim, from a health standpoint, exposure to mold and dampness are associated with coughing, sneezing, wheezing, upper respiratory irritation, and asthma symptoms in sensitized people. So it's really important as a homeowner or a property owner to get on top of moisture problems when you discover them. So that includes responding to plumbing and roof leaks as soon as possible. If your basement floods or if you have seepage, it's important to get your basement dried out as quickly as you can. I commonly recommend to folks, to almost everyone I talk with who has a basement, to run a dehumidifier all the time in order to minimize dampness in your basement and help control moisture. And then it's also important when you're cooking or when you're showering to use the exhaust fans that have been installed in your homes, and hopefully they've been ventilated directly to the outside.
Mold is something that can be hidden, but once you find it, it's pretty evident that you've got the problem. But there are other issues in homes that can be virtually invisible. You mentioned radon, carbon monoxide. People need to know about these potentially dangerous situations in a home.
Yeah, they do, Jim. It's important to just reinforce that you can't see or smell either one of these gases. So the only way to know if you have a problem is to either test for radon using a low-cost kit or to install a carbon monoxide alarm in your house to warn you when a dangerous condition is present. Neither one of these things is terribly expensive. You could pick up a short-term radon test kit at the hardware store for less than $20, and I think you can get a carbon monoxide kit for $20 to $25 as well.
Really important, easy early interventions to make sure that potential problems don't become major problems in a home. We're talking with Aaron Martin, Section Chief for Environmental Toxicology at IDPH. And Aaron, I think when people think about environmental health, the first thing to think of environment, we're talking about the outdoors, air, water, things like that. So let's turn our attention to some of that. Last year, for example, we had a lot of issues with air quality here in Illinois related to wildfires far away and that smoke-filled air that was then moving into our area. Now, we know that that's potentially an issue again this year. So how does that smoke in the air affect people, and what precautions do people need to take?
Jim, I remember sitting in my living room last summer during the height of that event, if you will, and I could smell the smoke, I could taste it, and I could feel it in my chest. It was decidedly unpleasant, so hopefully we don't have to deal with that again this summer. But exposure to wildfire smoke or fine particulate matter is a particular concern for young children who are still growing and developing. It's a concern for older people as well, especially those that have existing heart or lung conditions. And it may be a concern for people who live in environmental justice areas where they may be very near to sources of particulate exposure. This can trigger different kinds of heart or lung problems, such as an irregular heartbeat. It can aggravate asthma and cause breathing problems in people with existing conditions. In terms of precautions that people can take, one thing to do would be to get familiar with the airnow.gov website, where you can obtain the daily air quality forecast for your particular community. Better yet, you can download the airnow.gov app on your iPhone, or if you have an Android phone, they have an Android version of that app as well.
Again, we do encourage people to do that and keep an eye on those advisories, take them seriously when they're issued, and we'll continue to watch that carefully all through these coming summer months. We want to turn our attention now from air to water. Recently, IDPH joined with the Illinois State Water Survey to remind people with private wells to have them tested for the quality of that drinking water. Why is that important?
It's sort of like the other things that we talked about with radon and carbon monoxide. We have pockets in Illinois or areas where certain kinds of naturally occurring elements, such as arsenic, are present at higher levels in groundwater. And the only way you're going to know if that's an issue for you is if you test your water well. Likewise, if you live in an area where there are known sources of contamination, such as a hazardous waste site near your home, or if you live in an area where contaminants such as PFAS have been detected in the community water supply, we do recommend testing your private well.
And so, again, you can find out more at the Illinois Department of Public Health website. There's a lot more we could cover in this area of environmental health. We are unfortunately nearly out of time. But before we let you go, Aaron Martin, Kurt McAfee, any other environmental issues that you want to, make sure people are thinking about as we head into these summer months that your sections deal with? And then how can people get some assistance from IDPH with some of these issues?
We also maintain the Illinois fish consumption advisories. So it's summertime. It's a great time to be outside. Check us out at dph.illinois.gov, where we have an interactive map with a list of our advisories for methylmercury, PCBs, and PFAS. We also have some information on our site about harmful algal blooms, which will become a greater concern at surface waters during the warmer summer months.
We encourage people to get out and enjoy sport fishing, but you may want to limit your consumption of certain types of fish from certain waterways. And again, you can find out more by going to dph.illinois.gov. You can do searches for these various terms we've talked about and find much more information there. Aaron Martin, Section Chief for Environmental Toxicology at IDPH, Kurt McAfee, the manager of the Illinois Lead Program. Thank you both for joining us here. Join us again next time for another edition of This is Public Health with the Illinois Department of Public Health.